Good evening. I'm Dr. Rochna. I come from India. I've just been here for a month and I've come because my husband works here. I would like to ask Dr. Khadija that given all the vulnerability factors present in the region for HIV/AIDS, I would like to know whether the stakeholders, particularly the government and the religious leaders, to name a few, and the most important, I guess, do they accept that the problem exists, or are they still in the denial mode? Because considering India's experience, there was a long time we spent in denial mode, and that before we realized it was very late, and you know the condition of India. It's like 3.5 million people are infected and more double affected. So, I just wanted to know what is the belief, that whether the acceptance is there that there is a problem and the problem needs to be tackled and tackled early, or it's still in the denial mode. Thank you.
Okay, thanks, Roshana, for the question. So the first thing, the government, I would say, are aware that there is a problem. Yes. Now, whether how to tackle it, this is the differences, first of all, between governments. All the 20 countries are not alike. The second thing, they will tell you, and this is true, that we have other priorities, and this is exactly, we had so many H1N1 and so many epidemics, so much things, that they will tell you, why would I take care of just, I don't know how many people I have, and just leave alone. I mean, for instance, the problem of hepatitis C in some countries, it is a huge problem. I mean, sometimes you have 30% of your population, so why would the Minister of Health deal with that and not the other? So the governments are in this state of other priorities, and what is it, and it's long-term vision versus short-term vision. They are in this. And of course, yeah, this is what cost also Sub-Saharan Africa, the numbers they have. I mean, they have 3 times more than the world because they stayed in this denial, not knowing. And actually, our region is really where the increase is almost, we are the first, if not first or second region in the world where we still have this high, huge increase in the infection. Now, for the religious leaders, I would say that since we started with them, of course, it's a huge change, man. For them, it was important. First of all, religious leaders are not exposed to the information. They don't know, basically, they are there in their mosque and their church, because we work with the two religion, and basically preaching things. They don't have access. I believe some of them, most of them, maybe watch TV, but the TV, we don't really talk about AIDS except 1st of December. It's very rare that in another month, suddenly somebody is saying something. So they don't know, so they need to know. After that, you need to walk them through this experiential learning. You need to have in the room people living with HIV telling the story, and they have thousands of them. And this is the way for them to see, yes, now we see the problem, we want to be part of the solution, and they are being extremely innovative. You can trust me in having beautiful initiatives that they will fund themselves. This is the beauty. It's not like NGO, they will come back to request money, or us as UN. No, they will have their funding, they put it, they will decide that the zakat should go part of it to the orphans and widows of the AIDS. They can be as innovative, and they can also, they are moving towards this. We still have a long way to go, of course. The second beauty of working with them is that they would like to be involved in other developmental issues. It changed their whole way of seeing the others. I know an imam, I will not say the country, who now sits with men, having sex with men, and have a hello, and they felt close to him, he's dealing. He would have never dreamed in his life that he would, if you talk to him, and this is what he is saying, that he would have just killed the man or did something else. But now this is what I'm talking about, this compassionate and this stuff.